The following segment is sponsored by Movement Solutions.
Welcome back. Helping you get back to your active way of life is the goal of our guest this morning, Timothy Varghese, physical therapist and founder of Movement Solutions. Good morning.
Good morning.
Today we're talking about common back issues. What are the back problems you see in your patients and what causes them?
A lot of the common back problems that we see are people that have back pain for quite some time, a couple months, sometimes several years, bulging discs, arthritis, aches and pains, strains, pain standing, sitting, lifting, all those type of things that you typically hear of when someone has been dealing with back pain for quite some time.
And your back's connected with everything. A lot of regular activities that require mobility of the trunk are really limited when you have patients that have back problems. So how do you assess a patient's mobility?
So when someone comes to our office, we take a look at several regions of their body, and we have to account for mobility, strength and stability, and movement. So what we're going to take a look at today are some of the common mobility limitations that we see when someone has low back pain.
Okay,
so the first movement I'm going to take a look at, Margaret, is for you to sit in what's called long sitting on the table. So scoot back just a little bit, and I want you to be able to touch your toes. All right, wonderful. So that's considered normal. You can relax, Margaret. Now, oftentimes people with low back trouble, they have a hard time touching their toes. They're lacking mobility at the hamstrings, which are the muscles under your thighs, and mobility at the low back. And the combination of those two things will make it difficult for them to be able to touch their toes. What we look at next, oftentimes, is mobility through the muscles of the hips. The front of the hips, as well as the back of the hips. So today we're going to take a look at how the mobility is through the front of your hips, Margaret. I want you to scoot really close to the edge. Okay, good. And then I want you to let the legs dangle over the edge, and I want you to hug your right, or your left knee rather, to your chest. And what we're taking a look at here is this thigh, Margaret. Oftentimes, relax here as much as you can. What we'll see with people who have low back issues is that they'll have so much stiffness in their thighs that the entire leg will come up off the table. And we know if they have that much stiffness in their thighs, then there's going to be some limitations and compensations at their back. So we have to address the mobility limitations through the front of their thighs, what we call the hip flexor muscles, to be able to get them some relief and better movement.
Okay.
What we look at next is how mobile is the spine itself. So we'll have our patient go into a quadruped position, which means on all fours, and we'll just have them arch their back like a cat. So we're going to push, and what we'd like to see is a nice even curve from the bottom all the way to the neck. If most of the curve is here, like it is on you, Margaret, what we know is that the lower back is not moving quite as well as the upper back, and we have to restore the mobility in the lower back to get normal spine mechanics.
So I've got less mobility in the lower.
Yeah, less mobility in the lower than you do in the upper, and it's a very common thing that we see with some of our patients that have lower back trouble, is that they're so stiff through their lower back that it doesn't really want to move at all.
And you've probably, when a patient comes in, you walk them through the exercises and what they need to do to gain that mobility back.
When someone comes sees us, we put them through a full body movement assessment so we can identify anything that could be contributing to their low back problem, and then we develop a plan to be able to fix it and get them back to their active way of life.
Gotcha. For people who don't know about you yet, tell us a little bit about your background in the clinic.
So we started Movement Solutions in 2017. Primarily who we work with are people in their 40s, 50s, and 60s who are dealing with some sort of pain and injury, back pain for example, and it's affecting their quality of life and it's affecting their ability to be active. Lift weights, hike, play with their grandchildren, cycle, anything that you can think of. They're having a hard time doing those things because their back is bothering them, and then we help them get back to doing those things and living a higher quality life and enjoying their activities and hobbies again.
And the practice is obviously for active adults. What led you to have this passion for helping people?
Well, realized early on in my career who I enjoy working with the most were middle-aged people who had a heart to get back to being active, and I decided that, let's just create a practice where we can help these folks get back to their favorite activities, not have to have injections, surgeries, medications, and just enjoy life to their fullest.
Absolutely. Your facility is 117 Haywood Road inside the Alliance Champions Training Center. What do you want people to know about the process? Not everybody knows what happens when they go to a physical therapist.
Right. Oftentimes, before people want to work with us, they want some more information. So on our website, we've got guides for a lot of the common injuries that we see. We've got a back pain guide, so people can download that guide, get some insight into why their back might be bothering them, and then when they're ready for help, they can reach out, and we're glad to take care of them.
Fantastic. Anything else on what we should know about mobility in the back, or anything before we let you go for the day?
If you're missing mobility, then you have to do targeted specific movements and exercises to restore that mobility. And the best way to get started is to first figure out where you're limited. Is it the low back? Is it the posterior chain or the hamstrings? Is it the hip flexors? And then once we can identify exactly what's limited, then we know what we need to address.
And it's tailor-made for the patient, what they need.
Exactly. All of our programs are custom-oriented, so everyone is getting an individualized plan to be able to address their specific limitations.
Great. And that guide is really useful. You can request it, and you can learn more about Movement Solutions by visiting the website. The website is on your screen, movementsolutionsSC.com. Dr. Tim, thank you so much. We look forward to having you back.
Thanks for having me.
We'll send it back to you in the studio.